In this chapter, we're going to be looking at inequality in health, and we'll be considering how race impacts different people's health outcomes. Race and outcomes for health are correlated. The relationship establishes that minority group members are likely to die earlier from most serious health-related problems. Death rates for blacks are far above those than the other ethno-racial groups due to socioeconomic status. The rates are higher for Native Americans for accidents, suicide, and cirrhosis of the liver. Health inequality is high in our country. We don't have socialized medicine in the U.S., though we've seen changes in national policies in the past decade to help assure that most people have access to health services. Health inequality is not just a matter of services and care, but it's also impacted by environmental conditions. Those with less resources often have much higher exposures to toxic conditions. Health refers not only to our physical condition, but our mental condition and our ability to maintain a good sense of ourselves or even our own spirituality. Resources often impact our ability to maintain our health. We know that different groups have different health outcomes. While resources and environment play a big role in health outcomes, there is some personal choice that also plays into the individual's health outcomes. Smoking, drinking, drug use, bad food choices, and lack of exercise all have negative impacts for people. We also know that chronic stress plays a big role in health outcomes. In the past decade, there's been a lot of focus on ACEs, what's known as adverse childhood experiences. These look at the link between serious negative health outcomes late in life. For more information about this, see Nadine Burke-Harris's TED Talks. The U.S. does very poorly relative to other countries with the same economic circumstances regarding its health care and health outcomes. What kinds of treatments and approaches to specific conditions is guided by social convention and medical norms. Treatment in the U.S. comes at a high cost, and that cost is governed by the fact that American medicine is highly regulated, has high costs of advertising. Doctors have to be licensed under the American Medical Association as well as through their state boards. There's costs associated with the FDA, the Federal Drug Administration. They monitor medications, and there's also a cost associated with that monitoring. The legal system has a cost associated with it. Research and development comes at a cost. And there's a cost that's governed by the kind of research standards that the FDA imposes. And our system of insurance does not allow for an entirely free market system. There's generally not a competitive approach to pricing services in our healthcare system. Socialized medicine improves the lives of people who receive it. The U.S. has created its own system. Initially called the Affordable Care Act, it's already been morphed by the next executive body into a different version and will likely continue to transform over the years. If we were to compare ourselves to British society, who has truly socialized medicine, we would see that our outcomes are not as good even though we spend considerably more within our own healthcare system. So comparing the U.S. to Great Britain, our British counterparts would have a lower rate of routine examinations, a much lower use of prescription drugs, half as many radiographs, much less surgery, and their guiding principle, when in doubt, do nothing. Compared to that, the U.S. healthcare system is very different. The U.S. healthcare system revolves around strong malpractice concerns, and medicine in the U.S. is not socialized. It's a for-profit industry.